Hello, I'm Dr. Brandon Brock. It's my sincere pleasure to welcome you to Cerebrum Health Centers.
Some of the first things that you're going to be doing is some of the diagnostic testing that's going to provide the information so that we can build a customized treatment plan specific for you and for your brain. First, you're going to go through something called a V&G. And what we can do is graphically represent and measure the different parts of brain dysfunction so that we can pair them with very specific therapies that overcome brain dysfunction. In our diagnostic journey, another test that you're going to be going through is something called Computerized Dynamic Posturography. The reason that we evaluate balance is because it gives us comprehensive evaluation of brain function and brain activation patterns.
We also put this in perspective with a physical examination with labs and a multidisciplinary team, so that if somebody has dizziness or balance problems or can't walk appropriately, we can determine the cause, the prognosis, and we can make a treatment plan that's effective for that patient. One of those forms of treatment is what we call OVARD, and this is our patented technique.
This is a motorized chair that you sit in that can move you in two axes, left, right, and forward and backwards. This particular piece of technology actually works with what's referred to as your vestibular system, which is in direct control of your balance. Another intervention that we use is what's called RPSS, which stands for Repetitive Peripheral Somatosensory Stimulation. It's a fancy way of saying that we're going to be able to do some electrical stimulation to particular nerves anywhere from the top of your head to the bottom of your feet, and that stimulation has direct communication with parts of your brainstem and your central nervous system.
And one of the things that we utilize is eye exercises, so that what your eyes are doing can match what it is that your vestibular systems are needing. When we get the eyes in appropriate alignment, and then we get your balance and your brain in sync with your eyes, we notice that the patient has better function, can move better, and a lot of times can think better and perform better cognitively. At Cerebrum Health Centers, one of the things that we do that really makes us individual and specific is that we don't just do a neurological examination, but we also evaluate the entire metabolic system so that we can evaluate all of the things that can make the brain different but aren't really part of the brain. An example would be gut function, or thyroid function, or adrenal function. We look at all the things that can have a secondary or primary effect on neurological function. And when we identify these things, we're doing everything that we can to optimize neurological function. And many times we have patients that we treat that aren't just necessarily a neurological patient, but they want something to help them get through their autoimmune disease, or they want something to help them with their thyroid pathology, or they want to have better gut function. At this facility, we do everything we can to evaluate them comprehensively, look at them with a multidisciplinary team, and then come up with treatment approaches, whether it be through functional neurology, nutrition, or medication therapy.